The new year is almost upon us, and when it gets there, it might also prompt you to think about some new fitness goals too. It turns out that doesn't have to be complicated. Introducing a simple walk into your daily routine can, in itself, make a huge difference.
That's right. Walking is great for your heart, your mental health, and can also help prevent some chronic diseases like type 2 diabetes and some types of cancer. Elizabeth Kalige is an exercise physiologist and National Physical Activity Advisor for the Heart Foundation, and she joins us now. Elizabeth, great to have you on. What are the benefits of introducing a simple walk to your routine?
Well, simple walks really beneficial in regarding your cardiovascular health, and that's what the Heart Foundation is all about. But as you said, it's got numerous health benefits for your mental and your physical health, as well as your social well-being. If you're getting out there with different people, we can reduce the risk of heart disease, type 2 diabetes, some cancers, as mentioned. But it's also really important for getting our bodies moving and helping us to achieve those 24-hour movement guidelines. And what is that, you wonder? Is we want to get our adults to achieve 150 minutes or more of physical activity per week, and that works out to be about 30 minutes most days of the week. We want to try and look at exercising at a moderate to vigorous activity, so one where you're actually bringing your heart rate up and helping, and you feel like you can hold a conversation, but you should be able to whistle as well, but you're feeling a little bit more huff and puff. So exercise is really important for helping our bodies, for maintaining our overall well-being, and also helping to get that heart pumping, get our muscles moving, helping to build our strength as well.
So Elizabeth, I'm a bit of a wanderer. I do love a walk, but I wouldn't call it probably a walk. I'd call it more of a wander because I'm a bit slower. So that does not count at all, or does it just the movement help?
Every step counts. So for people who are able to step, get out there and do anything. So even if it's 10 minutes, parking the car further away, catching the bus to work or to your destination and getting off a stop earlier, wandering's fine, but we want to get our heart rate up. We want to build up that intensity. So we're doing a little bit extra. That's where the benefits come in. And some people might feel like it's a bit hard to get started, or you feel like a wanderer, but think about how do you do a little bit more every day? How do you build up that exercise, and how do you get that huff and puff happening? Because that's where the benefits count. But for anyone who's, find that they're sitting a little bit more, getting up and moving does have a bit more benefits than sitting still or lying. So getting up and moving is really important. It's beautiful weather. If it's hot, go inside and do some walking. But think about how can you build up to 30 minutes or more. And for more benefits, getting up to, what we say 300 minutes a week, which is about 5 hours across the week. So you can build it up. It doesn't have to be all in one hit.
What are some of the risks of inactivity or not moving your body?
Look, the benefits far outweigh the risks, and that's the important thing to remember, that a lot of people worry that, it might be risky to get started. You can see, some people jogging. Its benefits are far surpassing the risks. Any issues that may come up, maybe if you've had previous heart conditions or you've got any other health conditions, and it's important to go to your GP for review and discussion. But even people who have health conditions, the more that you do, the better it is for you, because exercise is that magic medicine to help us get moving. And it can help people with recovery from heart disease as well. We have our My Heart, My Life program, who helps people who might have been diagnosed with heart disease, or even have had an event, or they've been diagnosed with high blood pressure, high blood cholesterol. Exercise is really important, and it reduces the risk of you developing other types of conditions, and also reduces the risk of death and disability from lack of activity, because exercise is one of the major modifiable risk factors that contribute to cardiovascular disease. So get out and move. The risks are very, very low, and the benefits are very, very high.
Yeah, and I was reading the risks of not moving. It can increase your chances of diabetes, obviously, certain types of cancer, dementia, heart disease, and also stroke.
Yeah, Yeah, and not to mention a lot of musculoskeletal issues, so joint aches and pains that can actually be resolved with appropriate exercise for your body. So for those who are able, get out and move, and it can be walking. If you feel like you need to go swimming to help take some ease off the joints, that counts. Every movement counts. So we want to get people moving more and the way that it suits them. But walking is a really easy, simple way to get moving. Just put on some comfy shoes, put on some, hat and sunscreen. We're in summer right now, and get out there and move more.